What if I told you that semen contains chemicals that can directly affect your partner's mood, sleep, and even the health of a future pregnancy? Gentlemen, I'm Dr. Daniel Morgan, a board-certified urologist with over a decade of experience helping men over 50 understand the complex science of male sexual health and its profound impact on their partners. Today, we're going to talk about something most doctors deliberately avoid: the biological effects of semen on the female body. And I promise you, the research is going to challenge everything you thought you knew. This isn't about opinions. It isn't about personal preferences. This is about hard science. Recent studies have revealed that semen is far more than just a vehicle for reproduction. It's a sophisticated biochemical cocktail containing over 200 distinct proteins, hormones, and nutrients that can influence everything from mood and immune function to pregnancy outcomes. Let that sink in for a moment. Over 200 compounds. And most men have no idea. I get it. I understand why this topic makes people uncomfortable. We've been conditioned our entire lives to avoid these conversations. But here's the thing I've learned after more than a decade working with patients. Ignorance does not protect you. Knowledge does. And what truly frustrates me as a physician is that the medical establishment treats this subject like it doesn't exist. They won't discuss the science because it feels awkward. Meanwhile, myths and outright misinformation spread unchecked across the internet, in locker rooms, in bedrooms. That's exactly why I'm committed to bringing evidence-based information directly to you. Right now, hit that subscribe button and turn on notifications. Share this video with anyone who values scientific truth over cultural taboos. Drop a comment below and tell me where you're watching from. I read every single one. Your engagement helps this critical health content reach the men who need it most. So take just 2 seconds right now, subscribe, like, and comment. It matters more than you know. Now let's get into what the research actually shows. First, let's eliminate a massive misconception that I hear from patients constantly. Most men believe semen is primarily sperm. Here's the truth. Sperm cells make up only about 5 to 10% of total ejaculate volume. The remaining 90 to 95% is a complex fluid called seminal plasma. And this plasma is not just a passive carrier. It is a strategically engineered biological solution produced by your prostate, seminal vesicles, and other glands. Its evolutionary purpose is to protect, nourish, and energize sperm on their journey toward fertilization. Here's what's actually inside this biological cocktail. Approximately 60% comes from your seminal vesicles and contains fructose, a specific sugar that directly fuels sperm movement. Another 10 to 30% comes from your prostate gland, providing proteins and enzymes that protect sperm and regulate fluid consistency. Small contributions from additional glands provide lubrication and further protective compounds. But here's where it gets genuinely remarkable. Beyond these functional components, semen contains powerful hormones and mood-altering neurochemicals, compounds that are chemically identical to those that regulate emotions, stress levels, and feelings of well-being in the human brain. Specifically, semen contains cortisol, the body's primary stress hormone that regulates inflammation and immune response. It contains melatonin, the sleep hormone responsible for regulating circadian rhythms. It contains serotonin, the feel-good neurotransmitter that profoundly impacts mood and emotional stability. And critically, it contains oxytocin, often called the love hormone or bonding hormone, which fosters trust, intimacy, and deep social connection between people. From an evolutionary standpoint, this makes complete biological sense. This cocktail evolved to support reproduction, but when introduced to different parts of the human body, particularly through vaginal or oral contact, these components can be absorbed into the bloodstream and exert entirely different effects. Effects that have nothing to do with making a baby, but everything to do with the chemistry and health of your partner. I had a patient, 56 years old, sharp guy, engineer by trade, who sat across from me in my office and said, "Dr. Morgan, I had absolutely no idea my body was producing something this complex. I thought it was just sperm and water." That's the reality for most men. Understanding the composition of semen is the first step to understanding its potential effects. If this is already surprising you, hit that like button and drop a comment. Now let's talk about one of the most controversial and widely cited findings in this space: the potential antidepressant effect of semen exposure. A groundbreaking 2002 study conducted at SUNY Albany surveyed 293 sexually active college women. Researchers assessed their mood using the Beck Depression Inventory, a validated standard clinical measurement tool, and divided the participants into groups based on their condom usage patterns. The results were striking and difficult to ignore. Women who had direct exposure to their partner's semen, meaning no condom was used, reported significantly fewer depressive symptoms and demonstrated overall higher levels of happiness compared to women who consistently used condoms. Among women who always or usually used condoms, approximately 20% reported experiencing suicidal thoughts. Among those who sometimes used condoms, that number dropped to 7%. And among women who never used condoms, only 5% reported suicidal thoughts. Now, I want to be clear and precise here, because precision matters in medicine. This is correlation, not causation. The study did not account for all potentially confounding variables, relationship quality, emotional connection, or the psychological effects of intimacy itself. But the leading scientific hypothesis points directly to those psychoactive compounds I just described to you. The theory is that mood-elevating substances in semen, serotonin, oxytocin, and nerve growth factor are absorbed through vaginal or oral tissue and enter the bloodstream. Once circulating, these hormones and neurotransmitters could exert a systemic, antidepressant-like influence. In other words, the emotional lift that many women experience after intimacy may not be purely psychological. There may be a tangible biochemical component driving it. Beyond mood, the melatonin in semen could theoretically contribute to improved sleep and relaxation. While the quantity is small, its absorption may contribute to the calm, restful feeling that many people report following sexual intimacy. The oxytocin element is particularly compelling from a clinical standpoint. Oxytocin is central to emotional bonding. When absorbed during intimacy, it may biochemically reinforce feelings of trust, empathy, and connection between partners, not just as a feeling, but as a measurable neurological process. I worked with a couple, both in their early 60s, who reported that their intimacy actually deepened and improved after menopause when they stopped using barrier methods. The wife described feeling more emotionally grounded and significantly less anxious. I can't draw a direct causal line to semen exposure, but the timeline aligned precisely with what the research would predict. Comment below right now. Does this research surprise you? I want to hear your honest reaction. Now let's move into what I consider the most scientifically remarkable part of this conversation, the connection between semen exposure, the immune system, and pregnancy outcomes. Here's the core biological challenge you need to understand. A woman's immune system is designed and trained to recognize and attack foreign invaders. But a fetus is technically a foreign biological entity because half of its genetic material comes from the father. In some cases, the mother's immune system mounts an aggressive response to this foreign genetic material. The most dangerous manifestation of this response is preeclampsia, a serious and potentially life-threatening pregnancy complication involving dangerously elevated blood pressure, believed to be linked to an adverse maternal immune reaction to paternal genes embedded in the placenta. Here's where the science becomes genuinely extraordinary. Multiple studies have demonstrated that regular, long-term exposure to a partner's semen can help build what researchers call immunological tolerance. The mechanism works like this: by repeatedly introducing a woman's immune system to her partner's specific proteins and DNA through vaginal or even oral contact over time. Her immune system gradually learns to recognize this genetic material as safe, as familiar, as something to protect rather than attack. A 2003 study found that women who had shorter relationships, less than 4 months, and consistently used condoms before becoming pregnant were approximately 17 times more likely to develop preeclampsia compared to women in longer relationships with regular semen exposure. 17 times. That's not a marginal finding. That's a profound biological signal. Further studies and systematic reviews have confirmed this correlation. Women with more prolonged sexual exposure to the father's semen before conception showed significantly reduced risk of developing preeclampsia. The implication is that regular exposure functions as a kind of natural biological priming, preparing the immune system for a healthy pregnancy before conception even occurs. This mechanism operates through what researchers call paternal antigens in semen. These compounds work to increase maternal tolerance to the developing fetus, helping protect it from immune rejection and facilitating successful implantation and healthy placental development. Now I want to be absolutely direct with you, because responsible medicine requires this. This is fascinating research, but it is not medical advice. Semen exposure is not a guaranteed prevention for pregnancy complications. What it represents is an emerging area of reproductive immunology that couples, particularly those over 50, or those in which the female partner is in later reproductive years, should be aware of and discuss with their physician. I had a patient, 54 years old, whose 42-year-old wife had experienced 2 miscarriages. After I walked him through the research on immunological tolerance, they decided to focus on regular intimacy without barriers for 6 months before attempting another pregnancy. That pregnancy was successful, healthy, while I cannot establish direct causation. The science certainly supports the possibility that extended semen exposure played a protective immunological role. The immune system connection is real, it is profound, and it deserves serious scientific attention. Now, while these potential benefits are genuinely intriguing, I have an absolute obligation to address the serious risks. Balanced, complete information isn't optional in medicine. It is the foundation of ethical practice. The most immediate, undeniable, and non-negotiable danger is sexually transmitted infection transmission. This is the single most critical risk factor you need to understand. Semen is a primary transmission vehicle for viral and bacterial pathogens. The mucous membranes of the vagina and mouth are highly effective at absorbing these pathogens directly into the bloodstream. HIV, the virus responsible for AIDS, can be transmitted through vaginal or oral contact if there are any small cuts, sores, or areas of inflammation present. Herpes, both HSV1 and HSV2, transmits readily through semen contact, causing painful, recurring outbreaks that are lifelong. Human papillomavirus, HPV, is an especially serious concern. Certain strains cause genital warts, while others significantly elevate the risk of oropharyngeal cancers, cancers of the throat, the base of the tongue, and the tonsils. Rates of these specific cancers have been rising steadily, and oral HPV transmission through semen contact is a documented primary driver of this trend. Bacterial infections including chlamydia, gonorrhea, and syphilis can infect the throat and reproductive tract, leading to severe inflammatory responses and serious systemic health consequences if left undetected and untreated. Here is a crucial clinical fact that I cannot emphasize strongly enough. Many sexually transmitted infections are completely asymptomatic in the carrier. Your partner can be infected and fully contagious without presenting any visible signs whatsoever. This makes visual inspection not just unreliable, it makes it medically worthless as a screening tool. Beyond infectious disease, there is another serious risk that affects a smaller but significant population: allergic reactions to semen. This condition is called seminal plasma hypersensitivity. While rare, affecting an estimated 40,000 women in the United States, though almost certainly underreported, some individuals develop severe allergic responses to specific proteins present in semen. Symptoms range from mild, localized reactions such as itching, swelling, and hives in the oral or vaginal area to severe systemic anaphylactic reactions involving difficulty breathing and dangerous drops in blood pressure that require immediate emergency medical attention. There is also a direct link between male health behaviors and semen composition that men rarely consider. The health and lifestyle of the male partner directly determines semen safety. Toxins introduced through excessive alcohol consumption, illicit drug use, or high doses of certain medications can be present in seminal fluid. Introducing these substances through semen exposure means introducing them into your partner's body without her knowledge or consent. The only effective strategy for mitigating these very real and serious risks is this: absolute trust, complete and honest communication about sexual health histories, and consistent, regular health screenings for both partners. Without that foundation, the biological potential for connection becomes a vector for harm. I counseled a couple, both in their late 50s, 2 years into their relationship, who had never once discussed sty testing with each other. After the wife developed a throat infection that turned out to be gonorrhea, transmitted orally, their relationship was pushed to the breaking point. Full medical screening and treatment resolved the infection. The damage to their trust took considerably longer to heal. The risks here are real, serious, and completely non-negotiable. I say that as your doctor, not as a judgment. Gentlemen, let me bring everything together for you. Semen is far more biologically complex than the vast majority of men ever realize. It is not just sperm and fluid, it is a sophisticated, evolutionarily refined biochemical cocktail containing over 200 proteins, hormones including serotonin, oxytocin, and melatonin, and compounds that can meaningfully influence mood, immune function, and pregnancy outcomes in your partner's body. The research, while often correlational and still developing, suggests several areas of genuine potential benefit. Mood improvements mediated through neurotransmitter absorption, enhanced emotional bonding through oxytocin transfer during intimacy, reduced risk of serious pregnancy complications through long-term immunological tolerance building. These findings add a deeply compelling layer to our scientific understanding of human intimacy and the biological dialogue that occurs between partners, a dialogue that most of us never knew existed. However, and this cannot be overstated, these potential benefits exist alongside serious, undeniable, and life-altering risks. Sexually transmitted infection transmission including HIV, herpes, HPV, and bacterial pathogens, rare but potentially severe allergic reactions in sensitive individuals, and exposure to toxins that reflect the male partner's health choices and lifestyle habits. The purpose of everything I've shared today is not to tell you what to do or what not to do in the privacy of your relationship. My purpose as your physician, even through this screen, is to replace myth and silence with knowledge. Because real empowerment, real agency in your own health and the health of your partner comes from understanding the complete picture and making informed, conscious, and mutual decisions. For men over 50, this information carries particular weight. Whether you're navigating long-term relationships, new relationships, or shifting relationship dynamics that come with age and life transitions, understanding the biological complexity of semen equips you to make informed choices about protection, health screening, and how you communicate with your partner about these critical issues. This knowledge should only ever inform decisions that are made within a context of complete trust, open and honest communication, and a genuine shared commitment to each other's health and safety. There is no shortcut around that. There is no substitute for it. If this video gave you something valuable today, something you didn't know before, hit that like button right now. Tell me in the comments, what surprised you most? Did this change how you think about male sexual health? And if you want more honest, science-based guidance built specifically for men over 50, subscribe to Dr. Daniel Morgan Men's Health right now and turn on notifications so you never miss a video. I'm Dr. Daniel Morgan. Your sexual health matters, your partner's health matters, and the knowledge to make wise, informed decisions about both, that matters most of all. Take care of yourself, take care of the people you love, and I'll see you in the next one.